I'll forget. Great. So Lori, you should have a template. And so what you'll be doing is adding in the calcium, the kelp and salt to each batch, and then putting a holistic total body support on the food. For the butternut squash, yellow squash is easy. Just chop it up, throw it in there, cut the stem end off. Butternut squash, cut the stem end off, cut it in half, scoop out the seeds, pitch those out because they tend to not go through the GI tract well, and just cut it up into small chunks. And oh, good, there's Lori. Good, cool. So everybody's jumping in. So Lori, I'm actually in process of answering your question. So you should have a template for the crock-pot. If you did not get that, just reach out to Anna and Paul. You can grab that. Also, it's in the members area of iPets Ally and then on the website too. So you're going to use the calcium and the kelp, and then 2 cups of water, probably closer to 4 with the lentils. Just hack the butternut squash in half, trim off the stem, throw out the seeds, cut it into chunks. No, you don't have to peel it. I'm a lazy cook. And then ideally, yeah, you would soak black-eyed peas and kidneys. Lentils, not so much necessary. And if beef is not working, then you could, and I apologize, I can't remember what was on your test, but look for another option like pork or lamb or something of this nature, or bison. I've been hearing that food prices are starting to get just astronomically high in the US. So I think some of you are starting to have some problems there. So Lori, does that make sense? That rapid fire?
Actually, can you hear me okay?
Sure can.
Okay, so I caught the end of it. Did you say 2 cups or 4 cups of water?
If you're, I would probably try 4 cups if you're putting the lentils in dry, especially. And then if you're soaking the other beans, I would still probably use 4 cups and just kind of see what the consistency is. So you kind of have to play around with it a bit. Any other questions I didn't get covered for you?
Okay, so the squash, just throw away the ends and the seeds, and you can feed the peel. Okay.
Yeah, you can feed the peel.
Okay, and he's allergic to the garbanzo beans. I knew that from past experience. So can I just use lentils instead?
Absolutely.
Okay. And the turkey, I'm having a hard time finding turkey.
Yep.
Because everything is in like a glaze or something. But I did call one of the local butcher shops. But my question is so do I leave the skin on and then remove it after cooking? I'm assuming he shouldn't eat that skin, but
he can eat the skin.
Sure. He can.
Just make life easy. He'll probably think it's fabulous. Spirit is fascinated by this exchange.
And
he's like,
can I use the crock-pot fish oil can that be cooked, or is that only for add-on to food?
It's only for add-on. So, and what I would do with all the oils, because you're using grapeseed oil and the other oils as a source of calories as well, but with all of them, add it after the food has cooled. So we don't start breaking it down, right?
Okay,
does that make sense?
So don't put it in the crock pot is what you're saying.
Exactly. Yeah. So once it's finished cooking and it's sort of cooled down and you've got it sort of halfway processed out, then add the food afterwards. And if you added it while you're cooking 1 or 2 times, it's not a big deal. So don't sweat it.
Okay.
But going forward.
So the crock pot fish oil is only to add on food before you feed it then? I
Exactly.
shouldn't put that on the cooked food. Okay.
No, because what we're using that for is as a source of omega-3 fatty acids. And if you cook it, you will destroy the benefits. Plus, it just, it's an expensive oil to use for calories.
Okay.
Make
Okay.
sense?
And then don't add at this time any seaweed calcium or use any total body support either.
Correct, until you're sure what's going on, because if you'll have to sort of get him used to the food and then test the holistic total body support, because there is a B glandular present. And so what you we want to make sure that you want to make sure you're not creating a reaction by adding the supplement on top of the food. Does that make sense?
Okay, that does make sense. The other thing is I cannot find any tilapia that is not from China.
I know. And I think food choices are getting harder and harder. So go for your next best option as far as a whitefish goes. So cod, I hate using canned fish, but if you got to use it, mackerel is another option. Yeah.
I did buy some, I think it was haddock, but it's $12.99 a pound.
Yeah. Gosh, food is just going crazy.
I didn't check Costco, so I'll check there once. They might have something. Okay, well, thank you for answering all my questions. I do appreciate it.
With pleasure, with pleasure. And let's see. So Bettina, you've got 11 days of doxycycline left. This may be time to start whipping out the Vienna sausages and other abhorrent sort of non-food things that actually will get pills down. So liverwurst, sardines. So used to be, we'd break a chunk of sardine off, hand that, put the pill in the sardine, next piece of sardine, hand him the pill, and then hand another piece of sardine without pill. So you kind of get him into eating, and then hopefully he's not smart enough to sniff around the sardine the second time. Does that make sense?
Sure. Yeah, I've been using everything. I got almond butter. I've used, I did buy some liverwurst. Now I'm going to try that next. But yeah, he kind of like licks it, and then the pill comes out and he spits it. And then I find it on the couch, I find it under the rug, I find it everywhere but in his mouth.
Oh, that is so frustrating. You can get doxycycline that's compounded into a liquid. So, I think you could crush it and mix it with something that you could kind of squirt into his mouth that has some flavor. And see if that doesn't work as well, because it sounds like he's gotten wise to you. And
he's on to me.
And you're going to have more of a struggle. So I think anything you can find that'll work, and then I would shift, because you're having to dose twice a day. Yeah.
Yes, he gets 2 in the morning and 2 in the evening, 12 hours apart.
So I think you're going to have to, like, if sardines worked in the morning, use some liverwurst in the afternoon. And so you keep switching it up so he doesn't get quite so suspicious. I think
great. And then I had one more question about his blood work. I had it in there too. We test the dogs like every 6 months for D3. Yeah. And Mary is due for her test too, but Mary just had a dental procedure and her epilis removed last month. Yeah. And Murphy's on doxycycline. So how long should you wait after your dog's been like on anesthesia or on medicine before you do blood work?
I think, for D3, I don't think that will make a tremendous difference. So it's, and, if it has, then that's good to know, because it can take 60 days to catch up on the D3 level. Does that make sense?
Okay, sure.
Yeah. So I can't think of a reason why you would want to delay testing for D3.
Okay. Any other blood work that I should be, because Mary also gets a cancer test done every year. Should we wait for that a little bit? Or you think it's okay too, because she just had anesthesia last month?
Yeah, no, that shouldn't affect the cancer test. And then for Murphy, what might be a good idea is C-reactive protein, because that's going to be, it's going to give some measure of inflammation. You know, because he's feeling boatloads better, which is wonderful.
Oh yeah.
Yeah, but it's nice to know if the C-reactive protein has dropped down.
Okay, great. We can test that. Thank you.
With pleasure. And Kathy, it sounds like Dottie is finally starting to turn the curve, but she's got some issues, especially around fat. Is that what you're seeing?
Yes. Can you hear me?
Yes, we can.
Okay. Yes. And they didn't want to do any more testing if she's feeling better. And I said, well, what about this fat issue? And they said, well, just have her use just the fat from the meat that she eats. But I know that's not the right answer. This has been a chronic problem, and Daisy too had the same thing with fats all along.
Right. So there's, you know, chances are, but are Daisy's stools pretty normal at this point?
Yes.
Okay.
Yes.
Okay, so chances are good that this is not due to C-reactive protein. I mean, golly, my brain just went sideways. This is not due to exocrine pancreatic insufficiency, where they're just not making enough pancreatic enzymes to digest things. And if it is specifically around fat, one thing you could consider is cholesterol, or some other supplement that contains bile salts. And bile salts are, and that's what, sorry, this is fuzzy, but it is what it is. Bile salts are what help us digest fat. And so, for instance, with pets that have gallbladder sludging, we'll use a medication called Actigol or Ursodiol. And literally how somebody got here, I don't know, but literally initially this was made from polar bear bile salts. And then thankfully they started synthesizing it. But the reason this started working so well is that the bile salts help you digest fat better. And it helps to reduce the irritation in the biliary system. So this would be one thing to try to see if you add bile salts in, does her stool go back to normal completely? And then if that's the case, you know, can you add more fat or not? And then the other thing that's interesting is that when you give her fats, her ALT spikes. And so again, this sort of tells me that the biliary system is not very happy. So within each liver cell, there is the ability to produce some bile that goes into the biliary collecting system and then down into the gallbladder. So when you add fats and her ALT spikes, that's telling me that her gallbladder is not functioning properly. So whether that's because the bile is too thick and it's not getting into the gallbladder, because I know you went round and round and round with this while you were still in Morocco. This may be a solution. And I think she actually was on Ursodiol for a while as well. And that seemed to, and that brought her ALT down too, didn't it?
I can't remember. That was 2 years ago. And that's when I left Morocco and I was in the midst of all of that. And I think once we arrived in the States, they were still having problems, but there were so many changes going on.
Yeah, so I think I would visit that idea. So cholesterol, there's some other bile salt supplements that are perhaps a little more potent, if you will, available through full scripts. But I think I would go that route and see if that doesn't sort out the kind of greasy looking stool, because it sounds like it's just not, things are just not working properly there.
With fats, but without fats right now, she is okay. They both are okay, and the digestive enzymes seem to be working. Is this something I should be keeping Dottie on all the time?
I think so. I would definitely keep on with the digestive enzymes. But the issue is that you're not really able to add any fat into the diet, correct?
Correct.
And there are definitely some downsides to that long term. We know on the human side that people that are on low-fat diets and take lots of anti-cholesterol medications have much higher symptomatology as far as Parkinson's or MS or Alzheimer's. And also if if you're on a chronic low-fat diet, you don't make cell walls as well as you used to because you're not able to make so much cholesterol. So I think if you can figure out a way to help add a little bit more oil in that doesn't make her tummy upset, she's going to be better off in the long run. Does that make sense to you?
Yes. So should I give her this Sholacol? Should I give it to her for a while before adding fats, or starting it at the same time?
So what I would do is give it to her for, say, a week without adding the fats in, and then see, so kind of how is this affecting her? Does she feel better? Are you seeing an improvement? And then very, very, very slowly start adding a little more fat. Does that make sense to you?
Yes. These pills, what would be the appropriate dosage? She weighs right now about 33 pounds.
I would start with a half a tablet with each meal. And you may find that she needs upwards of the 2 tablets per meal. So again, this is where you're going to have to really kind of play with it and see how she responds. Does that make sense?
Yes, it does.
Yeah, good. Okay. What else can I help you with?
Everything, and I can't really think right now. But I mean, for the most part, they're doing really well. They're 9.5 years old, and they seem like healthy, happy dogs for the most part.
Great. That's great. And I know that diarrhea issue is just baffling and a real problem. So I'm glad it's finally chilling out.
Yes.
Yay. So Susan, you are just over supplements, and I get it. And if this is where you are, what I would do is frankly stop everything except for the ones that individual pets absolutely have to have. So for instance, I know you're starting with some quercetin to work on some allergies, but I would stop everything, including the green powder you're making, and give it a week to 10 days to let everything wash out. And then start to think about, okay, Abner's got lymphangiectasia. What's going to be really important for him to have? And I would, the slippery elm. If things fall apart on him when slippery elm goes away, then don't take it away. So I would go through that, think about what each of your pets needs desperately and actually needs. And instead of what you think might help them, stop everything else, and then make it earn its way back into what they're eating. Does that make sense to you?
Yes, because it's just like, it's so overwhelming. I read every day of new supplements that they need. And I'm just like, oh my God, how many supplements do I have to add to my dog's food?
Right. And that's it. I mean, we're starting to forget that supplements are just that. They are supplements to the diet. And so, the thing, as far as what do I think are the absolute day-to-day necessities, I think omega-3 fatty acids are. I think probiotics probably are, maybe not in every day, but 1 or 2 times a week. They're good. If your dog has GI issues, maybe it's an every day. Like for Hayo, we found out it's an every day for her. For Pepe, 2 to 3 times a week is good for him. I think joint supplements at some level are good on a daily basis. Maybe they don't need the full dose every day, or maybe they need it every day. But I think aside from that, then you just, like if you're adding trace minerals and using HTBS, then you're kind of duplicating what you're doing. Does that make sense?
Yes.
So I would just take everything out except for the things like Abner absolutely needs slippery elm, and and work from there. If you're not seeing CBD oil do a darn thing, then just stop it, put it away, and then maybe you need it for somebody else for some other reason. So it's
in a fortune on CBD oil. Oh my God, I spend $100 a month.
I know, and it's it is good stuff, is not cheap for sure. For Hyo, it is absolutely necessary. We tried to use it for Pepe for more arthritis related things, didn't do a lick of good for him. So she gets his leftovers. But yeah, make it all earn its way. That's the biggest thing to do. And it's like I do this about once or twice a year, is pretty much stop everything for myself that I know, except for the things I know I absolutely have to take. I know I have to take magnesium every night, and I know I have to take probiotics twice a day. But right now, I'm going to take everything out, let it stop it all, and make everything earn its way back in. Because we sort of get on this.
Is quercetin going to help
with allergies? Yes.
Yes, because I have a dog with severe allergies, and he's just going nuts right now.
Yeah, and I've actually had a lot of clients using the Histopause and able to take their dogs off of Apoquel. So for me, that's yeah, and for me, I mean, if this is the thing. I mean, that's just astonishing to me. But for me, quercetin is another one that is absolutely non-negotiable, and it's really interesting. I don't think I can get to this fast enough, but so I've been teaching the certified pet health coaching program, and we just did the liver module last week. And there is a picture of the liver and sort of the phase 1 detoxification, phase 2 detoxification, and all that good stuff. And the fascinating thing is that everywhere where turmeric was helpful, quercetin was as well. So for me, I can't take turmeric. I ended up getting a sensitivity to it, and I've seen several pups do that too. So I think quercetin is one of those things we forget about, its power and its ability to do a lot of different things. But I started using it because we started to see creatinines either stabilize or drop on it, and that's not supposed to happen. So try that out. And then for your 8-month-old puppy, is she a Lhasa or?
She is a rescue. So I'm told she's a Shih Tzu Schnauzer mix, but I'm not quite sure. I haven't done her DNA yet.
Okay. So Lhasas and Shih Tzus tend to have that, that varus and valgus where their feet are turning out. Is it both legs or just the one, or?
Both.
So this is more just her setup. Can you correct it surgically? Yeah, I'm sure you can find somebody to do it, but it may not be a problem for her. So, if she's not winging her elbows out, and she's able to walk with her arms straight, then I think you probably are okay. You will definitely want, she's a dog. I would start on, half doses of joint supplements, even as a puppy, because at some point that will catch up with her to some degree.
Half doses of what?
Half dose of a joint supplement, so glucosamine, chondroitin, MSM, hyaluronic acid. But, so I think it's just her stature. And, for me, my feet were this way for a long time. So I finally figured out how to correct them in, but I spent 45 years like that. So that has repercussions for spine health and stuff. Does that help?
She looks cute as hell when she does it.
Oh, I bet. And especially if she's got an undershot jaw and her little teeth sticking out.
She's so beautiful.
Cool. All right, let's see. And May, I know you've got a question over here. Okay, so around the 13th is where you tried the salmon oil and then things fell apart after that, right?
They fell apart and then got relatively better, but never good.
Right.
And we keep having a couple of fall aparts for no apparent reason.
Yeah. So here's what's interesting to me. So you were doing chia and banana and everything was really looking pretty good. And then chia, turnip, and rutabaga, and things are not so good. Does that make any sense to you that maybe the banana was more helpful?
I've gone back to banana just yesterday, I think.
Right. Okay. So give that a few days and see what happens. I mean, it sounds like for him, chia is excellent, but you've had the issue where you try different fibers and then
Right.
for any length of time, and then things fall apart. So
Yeah,
maybe
I'm feeling like turnip might not be so good.
it kind of looks like it. So you got turnip, mostly formed, so not too horrible. And then formed and soft is after a few days of turnip. So maybe what it is, and rutabaga looks like maybe that's a problem as well. So maybe what it is you end up with something like chia, banana, turnip, chia, banana, rutabaga. Who knows? I mean, you've had to do so much experimentation to keep things on the, sort of on the upper level. And then, and then you have this really icky day, the 25th of after a few days of turnip and rutabaga. So I don't know. I mean, it's just, I know it's incredibly frustrating. So what I would do is just, I mean, it sounds like chia is your sort of home base. So try that: chia, banana, turnip, chia, banana, rutabaga. And it looks like it's, when you have 3 consistent days of turnip, even though that's every other day, that's when things sort of fall apart. And then you throw a rutabaga in there.
I'm figuring turnip is almost out at this point, but
and that may be it. So maybe go back to chia, banana, chia, banana, chia, banana until things are good, and then try chia, banana, turnip, and then see what happens. So chia, banana, turnip, chia, banana, and then see what happens that 3rd day, because that looks like when things are going sideways on you. Does that make sense?
Yeah, and I'm afraid to try anything new until we're pretty good, because I won't know what's affecting him.
Yep.
In a couple days, we're probably 2 days away from needing to go on another heartworm pill.
Okay.
And I know
So go back to chia, banana, because that's been sort of good, and then see what happens with the heartworm pill on that rotation. Hopefully nothing.
There's usually at least a day of major drop, and then it's okay again.
All right. I mean, so that's coming, and then you can do the experimentation with turnip, rutabaga. There was something else that popped into my brain, but that went. Yeah, I see, because here, heartworm on the 26th, boom, boom. Actually, so the next day, the day after, it was mush. And that would be on the 28th, that would be what you expect with heartworm prevention. Is that right?
Yeah, and then there's a couple evenings that have the formed and soft,
Formed and
which
soft,
is better
where
than
it's-
mush.
Amen to that. All right, yeah, so give that a go and see. So at least all right, heartworm prevention, and then we're going to have two bad days, and then we'll go back to okay. So try that rotation and see if that helps. Good. I think that is good. And all right, so leaky urine, and this one I can answer relatively quickly, Dana. If this is new, make sure it's not a urinary tract infection or crystalluria. Is that new or not new?
She's on it. It's been going since last summer, and they've had her on Incurin, and then now she's on Proin. And every time I put these things into her food, I'm like, ugh.
Okay, so was it okay on Incurin, and then it stopped being okay?
I could never get it down. It was a full tab morning and night. So it just seemed, the thought was it was better to go on the Proin instead of staying on the Incurin.
Okay. So Proin was a weight loss drug on the human market that got yanked because when taken in excess, it created neurologic diseases like tremors and seizures. And because we are Americans, and if something is good, more must be better, many women actually really hurt themselves with this drug. Now, I've seen it be used safely for years and years and years in many dogs. I've also seen it create some really kind of weird, like anxiety, rarely seizures, rarely tremors, things of that nature. But it's not a medication without consequence. If you can't get Incurin down, then if your veterinarian will be so kind as to consider giving you a compounded estradiol. This is what, in the good old days, I'm old enough that I can whip this back out. There actually was a prescription product that got replaced because if you read about it, it will tell you that it will create aplastic anemia in the bone marrow. And that is true when it is used inappropriately. We used it as a mismade injection for dogs. So it's kind of like the morning after pill, if you will. But used at an appropriate dosage, and I think that was about 1 milligram, we could often get dogs from daily dosing down to one time a week, and it was very effective. This stems from the fact that we spay and neuter, and I think unfortunately for us, for women, as we hit menopause, urine incontinence becomes a problem as well, because our estrogen levels drop. And so unless you're doing lots of Kegels exercises and squats, it really can become just miserable. And unfortunately, we don't really have that option to help our female dogs sort of tighten things up, if you will. So low dose estrogen, I think, is reasonable. The other thing that has been helpful is Simplex F for female. And that you could use, and I'm sorry, I cannot remember how much your dog weighs.
Let's call her 45 to 50.
So I would start with the full dose of 3 tablets twice a day. And because that's going to give you the quickest assistance. And I won't tell you, and what I saw for a lot of my clients was that when they switched to home cooking and added in Simplex F, for many of them, they were able to get the dogs off of the medications completely. And for those that it just didn't work, the compounded estrogen worked reasonably well. And there were still some dogs where we just needed to use some Pro-N. For male dogs, it's so I'm sorry, I cannot remember the drug name, but unfortunately that doesn't work well for female dogs. So I would try those 3 things, see if your veterinarian is willing to get you compounded estrogen in lieu of the Pro-N. And, you know, if you say something like, oh, I just noticed that she's starting to be a lot more anxious than she had been, they may sort of listen to reason.
Skinny. She looks skinny. And that's what she was looking skinny.
So it sounds like you need to bump up the food.
Okay, as well. She's.
Well, and so let me ask you this, is since she started the Pro-N, that's what made her skinny, or since she started cooking?
I can't tell, because what disturbed me is that she started to leak again on 1 pill of the Pro-N, and now she's at 1.5 pills twice a day, and I'm not liking it. So I don't know.
Yeah, so just tell them that she's a little more anxious than she had been, and she's also dropping weight. I mean, this is a weight loss drug, right? So see if that helps. And then Cheryl, flea and tick treatments in immunocompromised cats. That's a tough one. And I've done a ton of research, which just was all very heartbreaking. I think for fleas, if you can get plain Lufenuron, which used to be called Program, I think Program Injectable is around, which I would not use in a cat because of the injection-associated fibrosarcomas. And then Capstar or Nidapiantum for fleas that pop on. And then there are boatloads of different videos that I've done about other alternatives. So amber collars. I still keep coming back to Seresto collars, even with all the scary stuff out there, because they actually work. And I honestly saw limited reactions as far as skin irritation where the collar was. If I have to use something for my own pets, that's what I use. And sadly, the chemical that seems to be creating the reactions in Seresto collars, your pet has drunk, breathed, and eaten more of than will ever be put on his or her body. Because they spray this stuff, especially in Florida and the southeastern states, for mosquito control. And in fact, Massachusetts had sprayed so much of it that they are having a hell of a time figuring out how to clean up their water supply. So, yippee, we've done it. We really pissed in the grits. So that's what I can say. And again, Cheryl, if your kitty is not outdoor much and you're not in an area with high flea and tick issues, you may be able to get away with not much, with using bug zone or something of this nature. So again, you just got to look at what's going on where you live. Now, and then a subject near and dear to Bettina's heart right now is Lyme disease. So we'll go through that because that's something I haven't reviewed in quite some time. So lo and behold, once upon a time, there was a Lyme vaccine for people. And it got pulled off the market, not because of efficacy, but because people were convinced that all vaccines are evil. And so it just stopped being sold. There's some discussion, interestingly, about bringing one back for people, but actually with a component of tick saliva that prevents the ticks from attaching. So, I mean, that would be pretty awesome. So it really is fascinating. There was a really excellent review article here, which I'll put in, I'll drop into the chat, and then we'll have this as a resource as well. But it's sort of pros and cons, and it's very, very different opinions. But it was a good review of everything. So includes, this was written in 14, so it's not quite up to date, but I thought it was an excellent review of what's what. So Dr. Littman's going through and, saying, our first prerogative as veterinarians is to do no harm. In her mind, the Lyme vaccine doesn't hit that mark. So again, she asks, what's the exposure risk in your area? And the other thing to remember is that Lyme maybe is the most common tick-borne disease, but maybe it's not. And actually, I couldn't find a clear answer to that. But the issue is that we also have anaplasmosis, ehrlichiosis, Rocky Mountain spotted fever, babesiosis, bartonellosis, and some others that are probably out there. And the issue is that if you have two of them, so if you have a co-infection with anaplasmosis and Lyme disease, the chances of you or your pet developing disease symptoms from this increase tenfold. For instance, in people with chronic Lyme, there's a lot of cross-infectivity with bartonellosis. And because it's, if you're not cognizant of that, it's difficult to get either one of them under control. So there's a lot of stuff out there. So the interesting thing is that statistically, about 5% of dogs that had tested positive for Lyme and actually had a CD4 test to make sure that they actually did have Lyme, and it wasn't just because of the test, the in-house test, less than 5% of them had Lyme arthritis. And generally, all of those dogs responded really quickly to doxycycline. There's, in the study she's quoting, 10 to 15% remain non-clinical carriers, and ultimately up to 40% of dogs diagnosed with Lyme disease were actually misdiagnosed, and often because that reflex test, the CD4 test, was never done. And so they had something else going on, creating the symptoms. And then the big thing in people is chronic Lyme disease, where that ends up developing into Lyme nephritis, heart disease, things of this nature. Less than 2% of dogs that tested positive ended up with more serious sort of systemic conditions. And the thing is that when this happens, it is horrible. But thankfully, it doesn't happen very often. But retrievers, weirdly and not surprisingly, seem to be more commonly affected by the more serious disease, but it's still quite uncommon for them as well. So again, it's probably an inability to handle inflammation well. And we know that golden retrievers and Labradors tend to have more serious diseases. So things like cancers, kidney disease, joint disease. So this is a problem with them handling inflammation more than anything else. And then again, she mentions the co-infection creating more serious disease, and really it all boils down to the importance of tick control. Now, the issue is that I think something like 30% of people that have Lyme disease, they've tested positive and they have symptoms, don't ever remember having a tick on themselves, which is fascinating. And I think there is to some degree that's present as well. So Bettina, do you remember seeing a tick on Murphy 3-4 months ago?
Yes, he had one tick by his ear on April 3rd.
Okay. And had that gotten?
That's the only tick. That was the only tick. It was a rather large tick. Yes, it was definitely in there for at least I would say 2 days size-wise.
Okay.
And which is weird because last year Bear had over 20 ticks throughout the summer and did not once have Lyme's.
Yeah, and that's the thing that's so amazing. So unfortunately, Murphy won the lottery, so to speak.
Yep.
So that's the frustrating thing. And that's the thing. If you find the ticks on them and pull them off, chances are good that they will not have had enough time for the organism, the Borrelia burgdorferi, to go from the tick into the dog's bloodstream. But I mean, you know, it all slips by us sometimes. I've pulled off engorged ticks off of my dogs, and it's like, geez, how did that happen? But yeah, when they're full like that, then they've been there for at least a couple of days. So tick control, super important. And then, you know, how do you end up doing that? Do you end up, you know, we're on a site that talks to veterinarians on today's veterinary practice. So here's an ad for Seresto. That's not the only solution, but it is a solution. And for my clients, so when I was in South Carolina, my clients from the Northeast would go up north in the summer. And what they were telling me was that their dogs didn't get Lyme disease, and many of them had Lyme disease in the past. And when they went for walks in the woods, they'd come back and there will be like, you know, 20 dead ticks on the pet's bed, which I think is also pretty awesome. The other question is how effective is the vaccine that we have currently? And it seems to help prevent disease, but it's somewhere between 60 and 86% effective. And many veterinarians are now using it every 6 months because, like the COVID vaccine, the duration of immunity seems to wane pretty quickly. So it also seems to be the one that creates many side effects. And they are, you know, unfortunately, they're not mild, like they feel cruddy for a day, but moderate. And so that's going to mean, you know, closer to anaphylaxis, fever, feeling crappy for a couple of days, things of this nature. So it's not without risk. And
right, and Murphy has seizures. That's why we don't vaccinate him. Mary has cancer. She can't be. And Bear with his Pica, eating rocks all the time. Every time he had a vaccine, we ended up with 3 surgeries. Because of
so I mean,
so we kind of we don't know what to do.
Yeah, so I mean, and that's where you are. You really are at the point where you just gotta do really good tick control. So I talked to a client last night who actually lives in South Carolina, and she's found some sort of system she set up she lives on the marsh, some sort of system that sprays cedar oil, which I thought was pretty slick. And so she's been able to really keep fleas under control that way. So this might be an option for you. You know, obviously, if you're walking them outside the property, it's outside your property, it's not going to help, but this may be something, you know, if you can find it. Cedar oil is non-toxic. It does keep the ticks under control. And if it's on some sort of a timer, you don't have to remember to spray the dogs every 12 to 24 hours. Right. So that might be, yeah, I mean, I haven't had time to research who makes this, but that was like, wow, that's a pretty awesome solution. So this protein is the one that creates the level of protection and prevents the dog from developing the disease. But again, it's not without potential problems, and you know, this kind of stuff is not fun. If that's a sequela of the Lyme vaccine, that's not cool. And unfortunately, this may happen 3, 4, 5, 6 months post-vaccine. So it may not be associated with, oh gosh, my dog had this vaccine and this is what happened. So and then the other thing is that ultimately, if only 60% of dogs are protected at the low end, they can still develop Lyme disease even if they've been vaccinated, and 86% is a most positive option. And I mean, and this is just, so in the dogs that are more severely impacted with Lyme nephritis, 30% of them had received the vaccine between 2 weeks to, you know, a little over a year and a half prior to illness. So it's not, you know, it's hard to know. Was it related to the vaccine? Was, you know, what? So there's a lot of questions out there.
How often should we test our dogs then? What is the safe rule if we don't vaccinate and we use natural preventatives for the Lyme and tick?
I would test them every 3 months.
Okay.
In tick season.
Okay.
Because it seems like, so from your description, Murphy was sort of being light sensitive and just kind of a little weird for several weeks before, you know, it became abundantly clear, oh, there really is a big problem, and he tested positive.
Murphy was tested in January and was negative. And then April 4th, we found the tick. And then about 3 days later, he became light sensitive, which he has done in the past. So we really didn't think of anything yet. And then in the first week of May, that's when he started having that droopy eye and everything was hanging down.
That's
and
right.
Then we had him tested right away. Yeah.
Now it used to
was hanging.
Yeah, it used to be too that in the Northeast, and again, I did not have time to quite research this, but it used to be in the Northeast because Lyme is everywhere there. If you found a tick on yourself, you could go into the pharmacy and said, I found a tick on myself, and they would give you a mega dose of doxycycline. And the theory was you take the mega dose and you're done. That may have changed because the disease got smarter. And so maybe, you know, if you find an attached tick, I think it takes up to a week to 2 weeks for the antibodies to develop, for the test to work. But maybe if you find a tick going forward, you call up your vet and say, I found an attached tick on my dog. Could I have some doxycycline, please? And just take that route as well. I mean, it is not innocuous because it is an antibiotic.